Medical directorship roles. How are they structured? How are they paid? Hey, it's John with Contract Diagnostics. If you have ever wondered about a medical director role, maybe it's something that you're doing now, or maybe it's something that you'd love to do in the future. We're going to talk today about being a medical director. So obviously it depends a lot about the position that you're in as far as the facility, what your specialty is, on what the roles of a medical director look like of a program. Most of the time we do see them paid, but they're paid usually per hour or on a flat fee. But if it's either one, it's usually requiring documentation on your hours. So the contract for a medical director is usually set up a little bit different than a contract for a regular employed physician. It may be in addition to their employment contract, or maybe a completely different set of documents. Typically in a medical director role, like I said, we would see it compensated, usually anywhere between an hourly rate, depending on the specialty. It varies from, $100 up to $400 per hour. We do see it capped usually on a monthly basis or paid all out in an annual amount. But in almost every situation for a medical director role, the facility will require you to keep track of your hours. So if they've got a delineated item list of responsibilities for the medical director, and usually these can be quite extensive, it's important to know if you can get them all done in a defined time frame. So for example, if there is a medical director role that's capped at, for math's sake, let's say $3,000 per month, and you're paid $100 per hour, and they list all of the roles, or all the requirements, all the meetings, all the requirements that are necessary for the program, can you get everything done in 30 hours? Because if you can't, if you're saying, I'm signing up to do these roles, but I'm also signing up to track my hours, but I know that I can't track more than 30 hours per month, it means that you might be giving away some of your time for free. So when we look at medical director roles here at Contract Diagnostics, I want to make sure, one, you can get out of it if you don't like it. I want to make sure that you can control the time that you input to it. I want to know, or I want you guys to know, if this can be on your shift. So if you're a hospitalist director, is it addition to your shift, or can you kind of double dip and do it during one of your hospitalist shifts? I'm going to want to know what happens if the duties are too many. You should definitely go through them and whittle them down if they are too many for the allocated time per month. And of course, if it's a set dollar amount with no tracking of time and no delineated duties, I'd want very clear discussion with the employer on what's going to be required to make sure that you're fulfilling the duties of the medical director for the compensation that's provided. Most of the time, employers will use this in fair market value calculations, but I don't know if they should, because it's an additional role with additional hours. Now, if the medical director is taking 0.2 of your time and you're a 0.8 physician and you're still up to 1.0 full time, then it might differ on how they're calculating fair market value. So I say all this knowing that medical director roles can be complex, and it is something that we can help out here at Contract Diagnostics. Not only understanding what the contract says and what it doesn't, providing you all good questions to ask as you go through the negotiation process, and hopefully maximizing the compensation that's included with that role. Again, I'm John at Contract Diagnostics, and if anybody has any questions on medical director roles or any type of physician contract, feel free to give us a call. Hit us at contractdiagnostics.com. We're always here to help with whatever you need.